Alright, so I know this is the second debate for you guys, so you guys are probably all falling asleep a little. But instead of, coming out with arguments, and I'm just going to try to show the human side of euthanasia. So I'm going to read some declarations from terminally ill patients who asked for physician-assisted suicide in a particular court case. I think it was in Washington. It was called Quill versus Fix. So, and this wasn't makeup. Actually, the first patient who had terminal illness, her name was Jane Doe, and she actually didn't even make it to the trial. She died before, so she didn't get to have her physician-assisted suicide. So actually, this is her declaration. I have a large cancerous tumor, which is wrapped around the right carotid artery in my neck, and is collapsing my esophagus, invading my voice box. The tumor has significantly reduced my ability to swallow and prevents me from eating anything but very thin liquids in extremely small amounts. The cancer has metastasized to my pleural stick cavity and is painful beyond a cough. In early July 1994, I had the feeding tube planted, and I suffered serious problems as a result. I take a variety of medications to manage the pain, but it's not possible for me to reduce my pain to an acceptable level of comfort and to retain an alert state. This time, it is clear to me, based on the advice of my doctors, that I am in the terminal phase of this disease, at the point at which I can no longer endure the pain and suffering associated with my cancer. I want to have drugs available for the purpose of hastening my death in a humane and certain manner. I want to be able to discuss freely with my treating physician my intention of hastening my death, the consumption of drugs prescribed for that purpose. So, that's from Jane Doe. This one's from Mr. Kingsley. And he says, at this time, I have almost no immune system function. My first major illness associated with AIDS was cryptosporidiosis, a parasitic infection which causes me severe fevers and diarrhea, and associated pain, suffering, and exhaustion. I also suffered from CMV, cytomegalovirus retinitis. It's an AIDS-related virus which attacked my retina and causes blindness. Today, I've become almost completely blind in my left eye, and I am at risk of losing my sight altogether from this condition. I also suffer from toxoplasmosis, a parasitic infection which causes lesions to develop in my brain. I take daily infusions of cytopine for the retinal condition. This medicine is administered for an hour through the Hickman tube, which is connected to an artery in my chest, prevents me from ever taking showers and making simple routine functions burdensome. In addition, I inject my leg daily with Neupogen to combat the deficient white cell count in my blood. The daily injection of this medication is extremely painful. At this point, it is clear to me, based on the advice of my doctors, I am in the terminal phase of AIDS. It is my desire that my physician prescribe suitable drugs for me to consume for the purpose of hastening my death, when and if my suffering becomes intolerable. And so, hopefully that makes you guys get a human side of the program we're trying to improve, we're trying to set up. So, Samantha actually said a couple things on the fact that the law in place in California, I think it's 402 or 401 actually, it's not intended to make people suffer. She's repeated it a couple times, but that's still the case. It's still making people suffer. You can't deny that. So I'm just gonna go through the significance claims that basically it's pretty much accepted that it's morally right, and therefore we should make it legally permissible. Most of the counter arguments against euthanasia are that basically there are going to be negative consequences to the emplacement of euthanasia in the state of California, but not that euthanasia isn't morally permissible. So what I want to see from the negative group is proof that basically our project is going to have, our plan is going to have negative consequences. Thank you.